As we go through life's many and varied experiences, our minds continually encode, store, and retrieve countless bits of information. Deep within our cerebral cortex lies the value of pi, our home address, a recipe for adobo, the names and faces of all our relatives and friends, the technique for driving a manual car, everything we know and understand about the world and about ourselves. However, our brain's ability to process information, learn, and remember can be affected by developmental, neurological, and medical conditions such as brain injuries, tumors, stroke, dementia, cognitive impairment, Parkinson's disease. The St. Luke's Memory Center is a hospital-based multidisciplinary service that provides comprehensive and detailed clinical assessments, management, and advisory services for individuals with memory complaints and other cognitive and behavioral disturbances. It is home to a team of highly trained specialists, neurologists, a geriatrician, a geriatric psychiatrist, psychologists, occupational therapists, speech pathologists, and nurse clinicians.
Memory Center in St. Luke's began in the year 2000, and I think that so far no other center has done the same way as our center since then. I would even say even most of Southeast Asia as a service center. Many other centers outside the country do research primarily, but as a service center, I think we are very unique. And as I said, there's no other center like us, at least in the Philippines.
The core service of the center is the Dementia Protocol, which includes an evaluation using the clinical dementia rating, complemented by standard psychometric battery and neuroimaging using the MRI scan. What is unique in the MRI is the added feature of hippocampal volumetry. This measures the size of the hippocampus, that part of the brain involved in the earliest stage of Alzheimer's disease. Other services are also available for comprehensive non-drug-based therapy. These are the CBT, cognitive and behavioral therapy, and speech-language evaluation therapy. In elderly individuals, changes in memory may be due to normal aging. In some cases, however, forgetfulness may be due to treatable medical conditions such as depression, hormonal imbalance, medication effects, nutritional deficiencies, neurological diseases, or degenerative processes such as Alzheimer's disease. The Dementia Protocol at the St. Luke's Memory Center can help elderly patients and their families determine if an individual is suffering from a memory disorder. It can help uncover the underlying cause of the disorder and to organize appropriate treatment and management plans for specific conditions.
The diagnosis of dementia remains to be very strictly clinical. So it entails an interview with a collateral informant, who is usually the spouse or an adult child, from whom we can get information, observations on the patient. And the selection of this collateral informant is also very critical, because there are informants who tend to, overprotect their patients. Some would also be too critical, and it overestimates the symptoms. Aside from getting information from these informants, we also have, of course, necessarily interview the patient, who eventually does a battery of psychological or psychometric or memory tests. We collate this information from the collateral informant and from the subject, and based on our clinical judgment, which is guided by clinical criteria, we determine whether that forgetfulness is normal for aging, whether that forgetfulness is more than what is allowed for age, therefore dementia syndrome. And we also try to look at all other factors that can contribute to such impairment if it is present, like depression, lack of sleep, obstructive sleep apnea, no? And many others. Medication, side effects of medications. Every time we diagnose dementia, to me, and we say it outright, that once a diagnosis of dementia is made, it's a family affair. Because the syndrome, the symptoms affect everyone in the family, much more so for those people who live with the subject. Therefore, we ask families and caregivers who go through an individualized module that our nurses give, teaching them how to deal with disturbing behaviors, with repetitiveness, yung mga makulit, what to expect in the future, how to handle this, how to handle also a distressed caregiver for those who hire helpers. Sometimes it can be distressing for them, so how to deal with them. So it's very much comprehensive and one-on-one, no? It's a very individualized thing that the families go through with our nurses. And the nurses are very well trained in handling this, in discussing problems or issues that arise with caregiving.
The St. Luke's Comprehensive Cognitive and Behavioral Therapy provides detailed assessment and cognitive therapy for patients with memory and cognitive difficulties. The program aims to restore, improve, and compensate a person's memory and cognitive abilities through individualized programs that will allow patients to function optimally in their daily environment.
In the early stages of dementia, where there is some forgetfulness but not all is lost, I recommend them to come through a memory enhancement program. Again, it's a very individualized, we cannot generalize, no? So, program that is undertaken with an occupational therapist or with our psychologist, and they deal with the specific symptoms of the subject, helping them cope in different situations and in different baselines. So there are old people who do not do the computers, so we don't use the memory aids using the computers, or who don't even use cell phones, so we don't talk to them about that. At least the therapists don't talk to them about that. But there are those who are like more or less updated, so they can use the computer in the center. It has a joystick. It trains memory, remembering. It tells them how to compensate for what they are forgetting.
Aside from pharmacological interventions, there are non-pharmaceutical interventions that would help improve their memory, maintain people awareness, and improve communication. St. Luke's Comprehensive Speech-Language Therapy Clinic aims to facilitate and restore functional speech, language, and communication skills through programs and holistic intervention.
What is new now in dementia are biomarkers. No? So biomarkers are tests that are done on patients to diagnose the disease in its very, very early stage. So for dementia, in particular Alzheimer's disease, we look at biomarkers using blood tests, the MRI, brain scan using the MRI, PET scan, and also cerebrospinal fluid markers that may indicate that the process of dementia is beginning in the brain. So we do this now in the center. We have begun using the MRI, measuring the volume of the hippocampi. These are parts of the brain that subserves short-term memory. We've been using that since last year, and we have a good data to tell us that it does help us very much. Going to start to use NeuroQuant. It's a software that will automatically calculate volume of the hippocampi. We also have been using PET scan, but not as much as the MRI. We are working closely with the RBD, Research and Biotechnology Division of the hospital, for us to start using the cerebrospinal fluid biomarkers as form of early detection, but only up to now still for research purposes. We are also doing genotyping studies, looking at risk genes. These are genes that put people at risk for developing Alzheimer's, which we still do not know locally at present. So I think in those terms, we are pretty much in sync with what's going around.
Science and medicine continue to discover new and better ways to care for patients with memory and cognitive difficulties. We at the Memory Center of St. Luke's aim to improve the quality of life for patients with dementia and expanding and extending dementia care through research. Ultimately, it is expertise.